behavioural science. And Ramadan Mubarak to those who are fasting this month. We have a session on MMR vaccine and Ramadan, so we're really pleased to see many of you join the call. I've got two co-hosts with me as well, so Fumi and Dr. Goyal. So pass over to Fumi to introduce yourself, Fumi, and then we'll go to Alia as well.
Thanks, Nora. Morning, everyone. My name is Fumi Worrell. I'm the Service Lead for Health Protection here at Birmingham City Council.
Thanks, Fumi.
Good morning. My name is Dr. Alia Goyal. I'm a sessional GP and I'm Vice Chair of the Midland Faculty of the Royal College of GPs.
Thank you both. So firstly, before we kickstart the session, we just want to say thank you to UKHSA, so the UK Health Security Agency, who have supported us and provided some content for the slides, the Muslim Council of Birmingham, Muslim Council of Britain, and the British Islamic Medical Association for some of the slides and content that we've used for this presentation. So a bit of housekeeping, if that's okay. So please do mute yourself and turn the cameras off. As we've mentioned, the session will be recorded. So if you do not wish to be recorded, please just let us know either in the chat or just drop us an email. If you do screenshot any of the slides for the purposes of social media, please can you just ensure any names of attendees are kind of edited from that screenshot. We're happy as a team for, if our video's on top, that's totally fine. But in terms of any names of attendees, please just make sure those names are cropped out. We're active on social media, so please feel free to tag us on X or Twitter. So we've got our public health, Healthy Brum, our City Council, so Birmingham City Council, myself, Fumi and Alia have got our social media handles there as well. And finally, the slides and the recording will be circulated after the session. So as I said, if anyone's missed, please do use the chat facility and function. Feel free to introduce yourself so we've got an idea of our audience. And if you do have any questions, there'll be an opportunity at the end. So a bit of an overview of the session and why you're here. So we will talk about the key messages and current situation of measles within Birmingham, a bit of introduction around measles and the MMR vaccine, bit of information background around Ramadan and the link with MMR immunisation, and then a bit of understanding, I guess, around the importance of behaviour change in making our decision. So without further ado, I am going to pass you over to Fumi to kickstart the webinar.
Brilliant. Thank you, Shanara. Thanks everyone for your time this morning. I'm going to start off by doing an introduction to measles and the MMR immunisation. These slides, the next 10 slides or so, contain a huge amount of information, and that was done deliberately so that when we share the slides, you can have all the information and look at it in your own time. I'm going to probably go through this quite quickly because I think the benefit for us is the Q&A and the discussion at the end. So I'm going to start off, as I always do with our webinars, with the key messages for everyone. So you might have seen this already if you've ever joined any of our of ours or my MMR webinars. So I'm just going to go through them and really highlight what the key messages are, what we want you to take away from this session in terms of MMR and measles. So most importantly, the MMR immunisation provides the best protection against measles. We have many decades of evidence and information about the immunisation, and we know that it is safe and it is effective and it is the best way to protect against measles. Secondly, there is an MMR immunisation that does not contain pork. It's called Priorix. It is available at all GP surgeries and it is free. So please ask for Priorix when you go and get your vaccination because it does not contain any pork products. Please contact your GP surgery to catch up with any MMR immunisation, and you can do this at any age. So yes, for children, but also for any adults who are not sure about their immunisation status, contact your GP practice and they will be able to help you and tell you whether you're vaccinated or not, and they will offer you a vaccine if you are due a vaccine. So please do catch up with your surgery, and it's not just for children, it's at any age. Anyone with suspected measles should not attend a healthcare setting without calling ahead first. So don't just appear to the GP practice or to urgent care or to the hospital without calling ahead. And that is because of how infectious measles is. So we'll get to that in the next few slides, but that's a really key message. And then finally, if you do have an unimmunized person who has been in close contact with someone who's had measles, they might be advised not to come into settings, be it a school or education setting or work, for a number of days. And again, this is to do with how infectious measles is. So we're going to get to that. So these are the key messages that I'd really like everyone to take home with them today. And we can go on to the next slide. Thanks, Shannara. Okay, so I really wanted to set the scene and the context of what's actually happening in Birmingham. So why are we all here today and why are we talking about this? Well, we're here because measles is circulating in Birmingham. And not only that, you know, an outbreak was declared back in January. So we know we're in an outbreak of measles in Birmingham, but not just Birmingham, it's also across the West Midlands, nationally and internationally. To date, there have been over 480 cases of measles in Birmingham since October 2023. So we're reaching the 500 number, which shows how important and serious this is. Also, a third to half of cases of people who've had measles have had to go to hospital because they've been so unwell. And we also know that the vast majority of these cases are people who are unvaccinated. And then on top of that, most of the cases are in children under 10 years old. So I think it just highlights the seriousness of the situation and the urgency of these messages. Can we go to the next slide, please? Thank you. So in 2023, we began to see a resurgence of measles in England and Europe. So why are we in the situation that we find ourselves? Well, there's been a rapid escalation of cases in the West Midlands and especially in Birmingham, which has had about 80% of all the cases across the West Midlands. And the reason for this is because coverage and uptake of MMR vaccine in the UK has fallen to the lowest level actually in over a decade. So the first dose of MMR vaccine is at 89.4%, and the second dose is even lower at 83.8%. But we know, and the WHO, the World Health Organization, recommends an uptake percentage of 95% to prevent outbreaks of measles happening. So because of this gap and because of the steady decline in people taking up the MMR vaccination, that's why we are now at risk of these outbreaks and the outbreak that we're currently seeing in Birmingham. Next slide, please. Okay, so what is measles? I'm sure most people on this call will know by now that measles is a virus. It spreads very quickly between people who are not vaccinated with the MMR immunization. And once symptoms start, people can become very unwell very quickly. You can get measles at any age, and often it's young children who catch and spread the infection, and that's been shown in the data we've collected in the last 5 to 6 months. So how does measles spread? Well, it tends to be airborne and it tends to be through close contact. So if you're in close contact with someone who has measles and you're unvaccinated for 15 minutes or longer, you are very likely to get the disease. And measles is the most infectious virus in humans, more infectious than COVID, HIV, etc. So it spreads very quickly in places where people are mixed closely together. As mentioned, the best protection from measles is by having 2 doses of the MMR vaccine. And it also protects against mumps and rubella, so we'll get to that. And you're protected if you've had measles before. So some people have had measles and are naturally now immune to it. A person with measles can spread the infection from 4 days before they get the classic measles rash to 4 days after developing the rash. So I'm just going to speak a bit more about that on the next slide. So the symptoms of measles. So symptoms of measles usually start between 10 to 12 days after catching the infection, but it can be up to 21 days for symptoms to develop. So they call this the incubation period. So once you've got measles, you might not immediately start showing the signs and symptoms, but you can, you do have this incubation period where you are then going to start showing the signs and symptoms. So the first signs include cold-like symptoms. So you can get these symptoms, which can be caused by any respiratory virus, which can make it difficult to diagnose. So most cases will have a high temperature or fever, which can go up to 40 degrees Celsius. And then you have these classic signs and symptoms, which you get in various respiratory illnesses I've mentioned. So a runny or blocked nose, sneezing, coughing, sore red watery eyes. And then you can get these white spots that appear inside the cheeks, on the back of the lips, and they last a few days. About 3 to 5 days after these cold-like symptoms, you can then get the classic measles rash, which can be a non-itchy red-brown rash that can start behind the ears before spreading. And the spots may be raised or be blotchy patches. And you can see from the pictures on the right of the slide that the rash can be harder to see on darker skins. Next slide, please. Okay. So as mentioned, it spreads very quickly in people who have not been vaccinated. And you can see from this diagram, I think it shows quite nicely just how infectious it can be. So if you have 100 susceptible people who are not vaccinated, who are exposed to a case, about 90 of them will catch measles, and 7 can have long-term or very serious complications. So I think people sometimes think that measles, oh, well, it can't be that serious, or maybe it's like other things like chickenpox, but actually it can be very serious and you can have long-term complications. So it's not as simple as just getting over it and nothing else happens. So I think that diagram sort of depicts that quite nicely. And as mentioned, many people will need to see their GP or go to urgent care or A&E, so do call ahead. And about 20 to 40% of cases will need to be admitted to hospital because of how unwell they become. And unfortunately, it can also affect the most vulnerable in society. So babies under 12 months that can't be vaccinated, pregnant women who also can't be vaccinated, and also immunosuppressed and immunocompromised people. And they are most at risk of complications. And unfortunately, on rare occasions, measles can be fatal. Next slide, please. So now I'm going to talk about the MMR vaccine. So MMR stands for measles, mumps, and rubella. It is the best protection against measles, but it also protects against these other 2 diseases. It's very effective. As I mentioned, we have decades of evidence and data that shows that it is safe. It is effective at protecting people, not just from the diseases, but also the complications that are caused by the diseases. And 2 doses are offered, one at 12 months or 1 year old, and at 40 months or 3 years and 4 months old. Next slide, please. So 2 doses of MMR gives an individual lifelong protection against measles. The 2 doses will give you 99% protection against catching the measles virus. And I've already talked about the uptake in Birmingham in England and how we need to get to that 95% uptake level to prevent any further outbreaks happening in Birmingham or across the West Midlands. Next slide, please. Okay, so I think this is my final slide before I hand over to Dr. Goyle. And it was just to compare the current outbreak with the most recent outbreak we had. So the last outbreak of measles we had was in 2018. It was a large outbreak. It affected predominantly our Roma and Romanian communities. There were 116 patients, of which 55 were hospitalized. In comparison, this outbreak is much larger. We're about to hit the 500 number in terms of cases, and it is spread across various communities. When it did start, it did impact quite significantly on our Muslim communities, but now it's spread right across and is affecting all faiths, all ethnicities, all communities. And around, as I've said, 1/3 to half of the cases have required hospitalization. And the vast majority are also unimmunized people and young children. So really, my key message is, let's get vaccinated and let's stop this outbreak. Let's do what we can to protect our loved ones and our communities. And now I'm going to hand over to Dr. Goyal. Thank you.
Thanks, Fumi. So my name's Dr. Alia Goyal, and I'm going to speak for a little bit about Ramadan. Next slide, please. So many of you will know that we are currently in the month of Ramadan, which many Muslims are observing currently. So that began on Monday the 11th of March and is expected to carry on until the 9th of April, subject to the moon sighting. And during the month, people fast between dawn and sunset, and they will also have increased obligations for prayer at night as well. And it's common to have one meal in the morning prior to the sunrise, and it's known as sahur. Some people call it seri, and then another one at iftar, which is directly after sunrise. And between those hours, we don't drink and we don't eat, and we don't drink even water. The end of Ramadan is marked by a huge celebration called Eid al-Fitr, which is called the festival of the breaking of the fast, and it's anticipated that this will happen on or around Wednesday the 10th of April. Next slide, please. So it's compulsory for all healthy Muslims who are adults to fast between those hours that I've mentioned, sunrise and sunset, with no eating or drinking during those hours. There are exemptions for people for fasting, which includes children, some children, the elderly, women who are pregnant, breastfeeding or menstruating, those with mental or physical illness, and those who are travelling. Often people start fasting from puberty, and so that's why some children who are at school, particularly in secondary school, may wish to fast as well. Thank you. Next slide. So there's lots of resources available about Ramadan and how to have a healthy Ramadan in particular. There's some very good resources from the British Islamic Medical Association, which really focus on maintaining your physical and mental strength during the month, really around choosing good healthy foods in order to break your fast, trying to avoid fried foods and sugary foods at that time, ensuring that you stay hydrated during the day, and really just an incentive to eat well rather than just to consume large quantities of food, which may ultimately make you feel groggy and unwell, and difficult to sustain energy during the day. One of the main problems that people have with Ramadan isn't really about the lack of food, it's more about the change of the routine and particularly fatigue. And so it's really important to have quality sleep when possible, and just your sleep routine and possibly your work routine if possible during Ramadan as well. Next slide, please. So we're going to talk a little bit about Ramadan and the MMR immunisation. So there's lots of guidance available around fasting, and as I've mentioned, British Islamic Medical Association is a key source, as well as the Muslim Council of Britain. And the decision whether or not to fast is often the patient's choice. Sometimes patients do have long-term mental or physical illnesses and choose to fast, but that they often seek advice from their doctors, but also the Muslim chaplains and their imams. Some people may prefer to have different timings for various activities. I recognise that sometimes people don't have choices around hospital appointments, but it may be the case that people prefer them at the end of the day or at the start of the day. But again, it's an individual choice. And for people in workplaces, it's often fosters an inclusive environment of arrangements for breaking of the fast are available, such as a quiet place to pray, and for where people can eat if possible. So there's lots of guidance also on what does and doesn't break the fast, and this is why it's pertinent to this webinar, because many scholars would agree that injections, particularly those in the muscles, which is where the MMR vaccine is given, doesn't break the fast. And there are also other aspects related to healthcare which don't break the fast as well, such as taking blood, use of eyes or eardrops, and using other means for administering medication that don't involve taking it by the mouth. Next slide, please. So Fumi's really nicely highlighted the current context and why we're talking about this today. And as she's mentioned, we do have an outbreak that's happening at the moment, and it's very easy to think, well, maybe I'll wait till the end of Ramadan, and then I'll get my MMR immunisation then. And the reason why we're having this webinar is really to press it. It's really important to try and to protect ourselves, protect our communities, protect our children in particular. And so that's why we think that it's important to get this message out, that Islamic scholars state that being immunised during Ramadan with the immunisation going straight into your muscle will not invalidate your fast. And this can actually help to protect the individual, but also our communities. And without having that, as I've said, and as Funmi is very nicely highlighted, the communities are very, very vulnerable. Next slide, please. So how can you be immunised during Ramadan? So with some of our community members, it may have been the case that they have previously declined having an immunisation, but rest assured, should you change your mind, your GP will always be there to help, and we would understand and we'd be able to offer you an appointment for that. There may be some other factors which could help to encourage you to get immunised during Ramadan. For example, you may find it easier to ask for a clinic later on in the day. You may ask for clinics outside of prayer times, but also for women, it may be an encouragement to receive their vaccination during the menstrual cycle, which is when they would be exempt from fasting. Next slide, please. And some excellent resources, again, from the British Islamic Medical Association around just a very nice poster about key messages for measles, with a diagram there of what the measles rash looks like, and again a reiteration that the majority of Islamic scholars are of the opinion that taking vaccines by injection into the muscle does not invalidate the fast. Thank you. Next slide. I'd like to hand over to Shanara now.
Thank you. Thank you, everyone. So as you've heard, we've heard a lot about measles and getting vaccinated during Ramadan. So I'm just going to briefly touch up on changing the behaviour of individuals in terms of actually getting vaccinated during this month. So just a bit of background around behaviour change. So in essence, it means to understand and change our thoughts and emotions and our behaviour, which all interlink. So it's what we think, what we do, and how we feel. So you may have heard this term quite a lot, vaccine hesitancy, and there's a lot of components that link to this. In particular, there's 3 components, and I'm mindful that it's probably quite small on the screen, but we can share the slides after. The definition is a delay in acceptance or refusal. So it could be, which has been covered at the start of the webinar, in terms of it may mean that you don't know that it actually doesn't invalidate your fast. So it's that knowledge, and that can be influenced by a range of factors. So our confidence, our level of trust in the vaccine, or the provider itself, complacency. So it could be that I'm healthy, I don't need to get the MMR vaccine, for example, and convenience. So I'm fasting throughout the day, and with iftar and breaking your fast and prayers, I just do not have the time to actually go and get vaccinated. So these are all possible questions that individuals could be asking themselves in terms of actually getting vaccinated. So I appreciate the slide can look a bit busy, what I've shown you, but it highlights our thought processes in terms of actually getting vaccinated. So 3 components, which links to the COMBI model. So the capability, opportunity, and our motivation in order to do a behaviour. So it's 3 parts, and we need all 3 parts in order to perform that behaviour. So in this case, getting vaccinated during Ramadan. So capability is very much around our knowledge. So the webinar we focused a lot around measles, the outbreak, what's happening in Birmingham and across West Midlands, what to look out for. So what does the rash look like? What are the symptoms? When can we get vaccinated? And that it doesn't invalidate our fast. So our capability is very much like, do we know where to go, and do we know that actually it's okay to get vaccinated during Ramadan? It does not break our fast. Do we know that support's available? So you could always have a conversation with your imams or your GP, health professionals, etc., to double check on that if you need that trustworthy support behind. And then, do you know why you should get immunised? So we focus a lot around measles is on the rise. We need to get vaccinated now. We need to protect our loved ones, our friends, and our family and our children. So we really can't wait until after Eid. So it's very much that capability of our behaviour. And then it's the opportunity. So do we have the time to get immunised during iftar or you know, or in between iftar and prayers, or, you know, when after work, for example, because as you can all appreciate, for those who are fasting, I think sunsets around 6 o'clock, you know, between 6 and half 6, and it'll extend when the time goes forward. So it's very much, do you have that time to actually make an appointment and go, you know, in between work and all other priorities as well? Do you also have the support? So it could be, do you have the encouragement from either your peers, your friends, your family, your religious leaders, your local mosque? Are they advocates for getting vaccinated during Ramadan? And then, do you have the correct processes and environments in place to get immunised? So that could be, you know, a lot of these vaccines are happening at GP surgeries. So do you have the time to go back and forth to your GP surgery, for example, if you live in a rural area? So it's all these questions that we ask ourselves in order for a behaviour to be performed. And then it's our motivation. So do we believe that getting immunised during Ramadan will lead us to healthier outcomes and will make us feel better, and it will actually prevent us from being ill in the long run as well? Do we have the belief that getting immunised outweighs any stigma attached? So, as we know, we've said a lot today, is Islamic scholars are very much saying, yes, you can get vaccinated, do get vaccinated. It does not invalidate your fast at all. Do we have that belief that actually it's okay to get vaccinated during Ramadan? It won't invalidate your fast. And then the other part of motivation is, someone may have had a bad experience getting vaccinated previously. So it could be, you know, whether it's a flu jab or COVID, and they're just a bit reluctant. It could be symptoms and side effects of a vaccine, and they don't want, you know, a sore arm, for example, if they're preparing their iftar, for example. So it's all these questions that we ask ourselves, and then that all these questions depend on whether we actually go and perform that behaviour, so whether we do get vaccinated or not. So I won't go much into this, but this is just a process that all of us as humans go through. It's a stages of change model in terms of our behaviour. So it could be someone's like, I can't get vaccinated, or I don't want to get vaccinated during Ramadan. It will invalidate my fast. I'm not doing it. And then they move into the contemplation where they're a bit umming and ahhing, and, you know, they've gone to their late night Tarawih prayers and they want to have a chat with their faith leader. And I just want to know a bit more information about whether I can get vaccinated during fasting. I know measles is on the rise. I just want to protect myself. So they're contemplating whether they actually perform that behaviour or not. And then preparation is where that individual is actually planning on getting vaccinated during this month. So it could be for women, for example, you know, anyone who's on their menstrual cycle, that they make an appointment during the time that they're on their cycle, because that time you don't fast. So they can kind of do that during the month. Or it could be, you know, just before you break your fast, you make an appointment half an hour before. If you've got a local GP, you can go book it in, get vaccinated, and then break your fast. And then action is very much, right, I'm going to my vaccine, I've made my appointment, it's on, you know, the 1st of April, I'm going at this time, I'm going to go before I break my fast, and that's it. That's their dose done. And then maintenance. So this is very much where you maintain your behaviour, and it could be, right, they've had their first jab during Ramadan, and now they need to have their second dose. So they can have that second dose, you know, when that time comes. And then next year, for example, during the flu, you know, if it's flu season, it's all that, it's maintaining your behaviour. And as we're all humans, we all go back a step. So it could be someone's maintained their behaviour, and then next year they're back to pre-contemplation. So this is just a bit of a guide, really, where we all are in terms of our behaviour. And we all do this every single day, no matter what decision we make. We are all on one of these action strands. So we appreciate we've spoken quite a lot at you in the last half an hour or so, and there's a lot of information to take in. But these are a couple of resources, really, really helpful resources that we've spoken about, generally about measles during Ramadan, and how to have a healthy and happy Ramadan as well. So what we're going to do now is, these are the key messages, that one step ahead of me, key messages that Fumi mentioned at the start, and we just wanted to go back to those messages, because these are the take homes that we want. There is a non-pork version, so that is something that you can take during this month. It's the best protection against measles. Please go and speak to your GP. And even if you're a bit unsure of whether you've had your MMR dose or not, please just call up your surgery and they can check for you. And even if you vaguely remember, as a child, if you weren't born in this country, you could always say, well, I think I may have had it, in a previous country. Can you just double check? The saying is that the message really is, even if you're not sure, you can get vaccinated again. There's no harm to yourself. So, you could, even if you're not sure, if you were born in Pakistan and came here when you were little and you're just not sure whether you had it when you were a kid, it is okay. You can get vaccinated again. That's no problem. If you do have anyone that suspects measles or with any symptoms, please do not attend any, healthcare setting. Please do call up. So these are our key messages that we're asking everyone to take with you today, and that you can get vaccinated during this month. And I think that's something that's really important that we just want to stress, because all of us, I'm sure, for those who do fast, we don't want our fast to be invalidated. This is a really important month for us all, and it's what can we do? And we have been told by Islamic scholars, etc., that it does not invalidate your fast. It goes through the muscle. So please don't delay. So we're just going to stop sharing, if that's okay. And we're just going to do a bit of a question and answer, but we'll stop the recording here as well, because we are mindful there may be some questions that people don't want to say in the recording. So we'll just stop the sharing and we will stop the recording, if that's okay, Junaid.